just want to mention I'm Krista Stevenson, the Executive Director of the Long Island Regional Bilingual Education Resource Network, also known as the Long Island Arbor. And we're here with Gaetano Vaccaro, our resource specialist, who and will be moderating for you today. And as I was beginning to say, I want to send a big thank you to our consultants, Eli Paywansky, Connie Randolph, and Juana Cruz Perez, who have really done all of the legwork in bringing this together today. And I really want to thank all of the community-based organizations who have joined us today, and excitingly, the Nassau County representatives who are with us today, including County Executive Laura Curran. So that's really exciting. And I would also like to give a big shout out to the Brentwood School District, Mr. Wayne Abenis, for again taking your time today to come and share what you've put together there. So without further ado, let's get started.
And so as you can see, I'm moving the agenda around because as Krista mentioned, we had more people that wanted to participate, and I wanted to make sure that all the names were there, and our agenda became 2 pages. So these are all the people that are scheduled to present and talk to you about all the services that they are offering the county right now during COVID-19, as well as additional services moving forward.
Cool.
So, Laura Curran's office, are you on the line with us?
Yes, I'm here. It's Laura.
Oh, good. Thank you for joining us.
Absolutely. Well, I really appreciate the opportunity to say hello and to say thank you for what you're doing. I know we're all learning this new remote way of providing these really important services to our various people that we serve. So I just want to say thank you for being adaptable and making sure that people are getting what they need. And I'm going to tell you very briefly, and then I'll jump off. First of all, thank you again. We're working really hard to reach all of our communities. So I know Amy Flores is on. She is the Executive Director of our Office of Hispanic Affairs here at the office. And she's been fantastic in making sure that we're reaching our Spanish-speaking community as much as possible. We're sending out texts in 6 languages. People can sign up for up to 6 languages, obviously including Spanish. We're also getting the word out about increased testing that we're doing right now in Hempstead and in Freeport.
Cool.
It's at the health clinics, so the community health clinics, the FQHC. So we're reminding everyone, you don't need insurance. If you can't pay, it's okay. And nobody's going to ask you about your immigration status. So we want to make sure that we're getting tests to everyone who needs it. We started food distribution in our at-risk communities, working with Island Harvest. That's going really well. Just yesterday, we fed 1,300 families at the Hempstead site. So we're pushing that out as much as we can. So if anyone has any questions, I'm happy to answer them. Other than that, I'm going to pop off. All right, very good. I just want to thank Amy from our Office of Hispanic Affairs. She's not long in the job. She's hit the ground running, and she's a real great asset, not just for me, but for our Spanish-speaking constituents here in Nassau County.
Thank you.
Thank you so much.
Thank you so much for joining us. We know how busy you are, and we really appreciate your time.
Well, I appreciate what you're doing. We really are in this together. So thank you.
Thanks.
So next we have Amy Flores, who is the Executive Director of Nassau County Office of Hispanic Affairs. So Amy, I'm just going to turn the floor over to you.
Thank you. Thank you so much. Can everyone see me?
Yep.
Okay, wonderful. So first and foremost, also thank you so much for giving us the opportunity to present and to provide our support and resources. The county executive is definitely very dedicated in ensuring that all communities have equal access to government. And the Nassau County Office of Hispanic Affairs focuses on providing outreach, particularly towards the growing Hispanic community, as we know are particularly increasing in Nassau County. And with that being said, Our office provides bilingual resources and support and services to everyone, regardless of their immigration status. Our entire team are bilingual, so we do speak English and Spanish. And, we are here as a safe resource. We know that right now during COVID-19, a lot of people are fearful of the unknown of what's happening in the future and what's happening now. So we want to be able to provide the messaging in various languages to ensure that everyone has the proper information they need to not only get tested, but where to go and get food. We have also been receiving a lot of phone calls because as educators, that, we are all working on a virtual platform right now. So just navigating and being a supportive resource for the community is very important for us. And, working remotely, we've also have opened up new innovative ways to be able to communicate with the community. Now, our office is currently closed to the public due to the COVID-19, but we still continue to provide support via phone. So we are taking phone calls. We help out via email and also via WhatsApp. We just started doing a WhatsApp application with which many of you might be familiar with, which allows people to be able to communicate, and receive messaging from our office via that application. And Facebook has been a very big communicating platform for us to be able to disseminate information in English, in Spanish, including videos. So, aside from social media, we want to be able to be a supportive resource for the community. And, I will also be sharing flyers with you that I'm going to be emailing out to the organizers of this program so that they can also share amongst everyone on the call. Like I said, everything is available in English and Spanish as well as other languages. But please know that, county government is here for you. And, we want to also hear from you so that the more we can communicate, the better we can, learn about what the needs are so that we can, help facilitate and support where needed. I will also send out the WhatsApp link as well. And I just wanted to share something. I'm not sure if I'll be able to do this, but I'm going to share my screen.
Okay, well, I will stop sharing mine so that you can share yours. How's that?
Okay, that would be great.
Great, thanks. Hold on one second.
Okay, great. And I also want to be cognizant of everyone's time, so I will try to keep this brief. Let's see. Okay. Okay. So if you simply just go online and you can simply just Google Nassau County Office of Hispanic Affairs. On our webpage, you will see that our information is there in Spanish. This QR code will lead them to the WhatsApp page. And this is the information in Spanish. And then we have this same information except in English. So a lot of our information is also on our website. We even have a video here talking about what is coronavirus and how you can take the necessary steps to keep yourself safe. And then we also have important phone numbers as well. We're also collecting medical supplies for the first responders. So a lot of information here right now has been updated for COVID-19 due to the recent pandemic that's happening right now. But I will also be emailing all of these resources for you. And, but please know that the website is also being updated constantly to help support. On the right-hand side, you'll see the social media link, so you can see that as well. And on the left-hand side, you will also see some other resources in regards to what to do if you're a business owner, as well as if somebody's looking for a job or if somebody's looking to know more about their rights as a worker. And that's also available in English and in Spanish. So we have a little bit of everything here. But just please know that that is also available for you to use and navigate. All right, so I'm going to just put this back to you.
Thank you so much for sharing that information. I just updated at the end of this presentation, we have various links, including a link to our resource guide, which they can find that information as well. However, if you forward that information to us, Krista will send to all the participants who have joined us today any information that we get from the community-based organizations. So we will go ahead and send anything you give us, we'll send that out.
Will do. Thank you so much. And if anyone has any questions for me, then I'll be more than happy to answer them.
That's great. Thank you.
The questions in the chat right now are basically asking what is the number on WhatsApp and the Facebook page. The Facebook that you mentioned, is that just the county page?
The Facebook page is actually, it's called Nassau County Office of Hispanic Affairs. And if you go to our website and you just click on the actual link to Facebook, it'll direct you there.
Okay, great. We'll post that in the chat when we get a chance. And the WhatsApp, we'll make sure we send everyone the QR code for the WhatsApp as soon as we're finished.
Perfect.
Great. Amy, thank you so much for joining us last second. We really appreciate it and the information that you have to share with our community.
Thank you. Thank you for having me.
Pleasure. Okay, so if we don't have any other questions, there's anything available for that? Okay. Krista, there's a question over there. It says, "Our undocumented people are working. Anything available for them?"
Yes. Right now for people who are undocumented, we have been helping them by providing a link to United Way. United Way is currently offering assistance via gift cards. The person just needs to apply, and the application is available in English and Spanish. So I'll make sure to send that out to you. And then also the food pantries available across Nassau County also are providing food regardless of immigration status.
Okay. And then
so someone else put in the chat to me, a number of families have expressed concerns about being worried that landlords will kick them out. Is there a certain number that they can call?
Yes, right now, you know, as you know, nobody can be discriminated against, especially because right now there is a moratorium for 90 days. So if someone feels at risk at the moment that they're being threatened, I would recommend for them to contact our office, which is 516-572-0750. And we will help facilitate them, especially if they're Spanish speaking. We want to be able to make sure that their messaging is connected with, you know, either the Sheriff's Department or with the Attorney General's office. I will also be sending over an email where claims can also be reported to if they feel that they've been discriminated against.
So is there like an advocacy group or someone in your office that they can contact? Like, we can tell you anecdotally that we have heard stories of people being evicted during the 90-day moratorium, but because these are people who are undocumented, might be living in illegal apartments, they're reluctant to report it or to advocate for themselves because they're afraid of, you know, of a lot of things happening. So is there a place where they can go where they might not feel, where they might feel more comfortable reporting?
I would direct them to my office because in many cases we can speak with them and get the full picture of the story, and then we can work as a liaison between you know, either the Department of Housing or including, you know, with the police department, because we do not want anyone to feel in fear, including if they're renting a room or if they're in an illegal apartment. You know, they still have rights, and regardless of their immigration status. So we would like for them to reach out to our office so that we can help navigate them the best possible way.
Right. Great.
There's that question about the 90-day moratorium. When is it over? Is there a date at the moment? And is the date being moved as things are being moved?
Yes, the date I believe is in June, and of the 90 days, 30 days has already passed, so we're looking at 60 days. We don't know if it's been extended. As of right now, it still remains the same. But, you know, if you connect with us and, you know, we will now be sharing information with you as soon as we have it, so that you can also share amongst your, you know, your families.
Great. So we'll share that, because also at the end of this presentation, I have a page of resources for families, and I've included the Nassau Suffolk Law Service and a
Yes.
link to that. That's not your office though.
That's not our office, but we do have a relationship with them, and those are attorneys that can assist. And I am also aware that they are bilingual, so so that is definitely a good reference. The Nassau County Bar Association is also providing assistance for legal consultations, which is free. So that is also a resource that I can share with you as well that you can use.
That would be great. We really appreciate that.
Absolutely.
Great. Are there any more questions before we let Amy go? Okay.
So at the end of the 90-day moratorium, are tenants expected to make up rent payments?
Right now, that is an ongoing conversation that people are having. I can get back to you in regards to what the definitive answer is on that. So I can look into that further and let you know.
Okay, great. Thank you. That is something that a lot of people are worried about. So yeah, we'll definitely have to keep in contact. Pardon?
I'll circle back with you as soon as I have the response to that.
Great.
Perfect. Wonderful.
Well, we thank you again for your time. I know it's a crazy time right now, so thank you.
Absolutely. Well, thank you. And if anyone needs anything, please do not hesitate to reach out to our office, and we will do the best that we can to help you. And thank you so much for having me.
Thanks again. Great. So what we have, oh, here we go. I have too many things going on here. So next I want to present Mr. Wayne Venice from Brentwood High School, who serves as the district coordinator of guidance for Brentwood High School and has been with them for 22 years. He's also served as a guidance counselor and assistant principal in the district. And he's going to briefly talk about the programs and what services they've been offering to their students. So.
Hi, thank you for inviting me back, and thank you for hosting this presentation. I think it's fabulous to get everybody together and share the resources that are out there for the communities. In Brentwood, one of the first things that we decided to implement was a community hotline for parents and students to contact in order to provide support, suggestions, and strategies for coping with and responding to the mental health and emotional stress that comes along with COVID-19. So it's fantastic. So far, we've had a lot of parents that are calling in, and we're sharing the different resources out there in the community. When a parent or student calls in, they can expect to be spoken to by a Brentwood school social worker, a nurse, or a guidance counselor, or one of our psychologists. They receive support, suggestions, and strategies for coping with and responding to, pretty much any questions that they have, and we can align them with resources that are out there in the school as well as out in the Brentwood community that are specific to their needs. We do have a COVID-19 testing center in the district. It's at our recreation center, so we direct families that are sick to the center, obviously. And we do have food pantries, and we offer bereavement services for students when they call in. And we've done a lot of fundraising with the United Way and with different local businesses to provide support for families that are in need. We have many parents that are out of work, obviously, and parents that are just home because they're sick and need resources, food, and we're just very busy with helping out all of the families that are being impacted at this time. But we do also have all of our students have a guidance counselor, K through 12, and they're available for our students through email or through Teams. And then obviously the old-fashioned way, we call a lot of our students every day, and we're keeping in touch with those kids that are at risk, and maintaining those relationships with families. Just wanted to see if anybody had any questions as to how we set it up, or how it operates, because we do operate the hotline from 8 a.m. to 3 p.m. And the way we broke it up with having so many psychologists, nurses, and guidance counselors and social workers, so any given day we have 2 shifts. So one window would be between 8 and 11, and the other shift would be between 11 and 3. And people would call the one hotline, and the calls get routed to the counselor's personal cell phone. So that's where they would, pick up the phone call, field it, and then just record whether or not it's one of our students that we would have to follow up on. Did anybody have any questions out there? I don't have the chat on, so I can't see that.
There was a question about contacting United Way. So I put in the link for unitedway.org where you can put your zip code, and you can find the local office in your area. In addition, Krista posted a number, 888-774-7633. So those are 2 ways to contact United Way.
Yeah, the United Way has been fantastic. They've reached out to our coordinator of bilingual services, actually our assistant superintendent for bilingual and E&L services, and they've donated generously to help the students who lost a parent, and we're giving out gift cards to families. So they've been fantastic with us.
Right.
So I would suggest anybody who would like to reach out to United Way and see if they could support your school district or community.
That's a great idea. The United Way is always there, and I think to a certain extent underutilized.
Yeah. Also, several of my guidance counselors composed letters and mailed them out to local businesses, and they've been tremendous in offering monetary donations. And we've been buying groceries, because not only the food pantries that are out in the community, but several of our schools house food pantries, and we just about ran out of food. At the high school, we have a food pantry where students that are in need, either if they're McKinney-Bento or just in need, they could fill out a form with what they would like. And at this point, we've almost run out of food in the pantry at the high school and at the middle schools. So we're using a lot of the donations that come in to replenish the food pantries and getting food back into the community. Lots of and there's actually one of the local pizzerias was donating pies to some of the families that have lost a loved one, and they were going to be delivered this week. So are there any other questions out there?
Well, that's great. I had myself on mute and didn't realize it.
Yeah.
So do we have any other questions for Mr. Ibanez? Is COVID testing available in Brentwood?
Yeah, there is a COVID testing site set up at the Brentwood. It's actually a Town of Islip Recreation Center. I'm not sure of the hours, but they are set up, and it's been set up for several weeks now. And I'm sure you all know Brentwood's been a hotspot for COVID-19. So the community is taking advantage of it, and hopefully many more will, because we have the largest suburban school district out here on Long Island, if not in New York.
In the whole state.
In the whole state. So, we have probably the largest ENL and bilingual population. So we're very busy, as you can imagine, in Brentwood. So we do offer a tremendous amount of resources and opportunities for families to come get help. And, you know, having the hotline is fantastic. And, you know, our teachers are also instrumental in making sure their students are taken care of and alerting us, the guidance staff and the special services department to help out any families that are in need. So, and we work very close with one another.
And we had
Great.
another question here. It says, if parents can't come to school to get lunches, how do you get them out to the parents, especially those who don't have cars?
Okay, so yeah, we do have the grab and go food plan at several of the buildings, which, you know, anybody pretty much can come to at this point. Families that do have a need, that don't have transportation, we have been delivering food to families. I have social workers, guidance counselors, and, you know, through our registration department, we have a liaison, a McKinney Vento liaison. So she's been working very diligently to identify families who do not have transportation. So not only for those that are in need of food, but it's also for students who don't have access to technology and need to get packets of information and classwork. So, you know, if they can't make it, you know, we have people that are willing to drive to their homes or to the shelter and drop food off. Some of the, obviously, packets we mail home, but as far as food, we do have delivery to, you know, those that need it.
Great.
So, go ahead.
No, I was going to say, I was going to get back to something you were just talking about, corona testing. And I did post the coronavirus call center for Nassau County on the chat window. In addition, it will appear on our resources for families on our last slide. So that will be accessible to our participants.
And there was another question that came in. It says, do you have families that are having difficulties connecting to Google Classroom or other technology? And how are you supporting them or guiding them to install the correct platform or browser? And do you have IT support in Spanish?
Yeah, that's a great question. We do have IT support in Spanish. Also, our hotline is, you know, manned by bilingual staff. As far as technology, we're doing our best to make sure that kids have the information they need to log on. We don't have the capability of providing everybody with laptops or Chromebooks or an iPad at this point. That's something that I believe central administration is considering, but we're not quite there yet with about 20,000 students. So obviously that's a costly expense, and with probably about 80% of our students receiving free or reduced lunch, that's a lot of students. But we do have the support for students who need information on accessing the technology that have, you know, a device. You know, I work at the high school, but I also supervise K through 12, and, you know, I've had numerous conversations with our students, you know, that are in AP enrolled classes, and I'm working with the College Board to make sure that these students that need it at that level get devices. College Board has been great with putting Brentwood on the list and working with Donors Choose in order to get devices. So any educators that are out there could open an account with Donors Choose and then request devices that way. At the elementary and middle school level, you know, we don't have, like I said before, we don't have devices available, but you know, we're something that, you know, I hope we're hopeful that we're working on for the future, and we do have support. Yeah, and, you know, obviously we're sending packets home.
Yeah, so we've heard about the assistant
It's-
superintendent putting them out the window for the teachers who are taking them out to the students. It's
Yeah.
really
So
a group effort there.
Yeah, initially it started, everything was being funneled through our central administration by Ms. Wanda Ortiz. And now students will be directed back to their building to pick up packets if they don't have access to technology and can't log in. Someone asked before about if it was which platform are we using. We're using Microsoft 365. So students have access to, Word, PowerPoint, anything in Microsoft 365. A lot of the teachers are using Teams. So every single teacher has their course and their roster in a team, so they could post a message through that platform. They could put links on there to different YouTube videos that they create. If they could also use the whiteboard feature that's in Microsoft to record themselves conducting a lesson.
We had the pleasure of one of your teachers actually just briefly showing, we did a flipped learning webinar, and one of your social studies teachers was showing us how they utilize Team 365 and how they have the assignments and all that. So that was very helpful. Thank you.
Yeah, one thing we just did yesterday, we conducted a question and answer session with the superintendent. So I had several high school students compose questions that other high school students had. We probably had about 40 to 50 questions, and we recorded a session similar to this. It wasn't on Zoom, it was on Teams, and it was myself, the building principal, and the superintendent, and we fielded lots of questions. We recorded it, and now it's on YouTube. So and we attach it to our Facebook page. So, we're doing our best to make sure that students get the information that they want regarding, many different topics such as graduation, prom, awards nights, scholarships, all the different things that typically would happen at the end of a school year with not knowing whether or not we're going back or not at this point. But, that's one thing that we just did recently for the community with the superintendent, which was, fantastic. It was real nice.
Great. Well, thank you so much for taking your time again to sharing this information with our colleagues out here in Nassau County as well.
Well, thank you for having me. I'm available if anybody has any questions or would like information on how we got it started. You can always reach me on the Brentwood website there. My email is somewhere on there. It'll feel pretty easy to find. So thanks again.
Thank you.
And thank you.
Okay.
And I just want to reiterate, guys, thanks. All the information that you've shared with us has been really helpful and giving everyone lots of ideas for how they can increase the outreach in their district. So thank you again.
Yes.
No problem. Thank you. Bye.
Great. So next we have Regina Barros, who's the Associate Executive Director of the North Shore Child and Family Guidance Center. And she's been dedicated to working with children, youth, and families who have been impacted by psychosocial stressors such as high poverty, drug and alcohol abuse, mental illness, and trauma. She directly supervises multi-programs and staff at the center, and she's been there since 1989. So Regina, thank you and welcome. Oh, are you on mute?
Mute.
There
Okay.
you go.
All right. And are you able to see me? Because I can't see anyone. I'm just kind of.
Yes, we can see you.
Yes, you, okay.
Yeah.
Okay, hi.
Hi.
So thank you for having me join you. We've been working very, very hard since we had to quickly close our sites to make it safe. Once we got the first positive in one of the buildings, it was clear that shortly after that, the contagion was going to spread very, very quickly, and a number of us got ill pretty quick. One of them. But thank God, we're fine. And the people, all the staff that did test positive, we're on the mend. But we were ready to move our clinical services remote. All of our clinical staff are working from home using remote services. We had been preparing this way in case it came. We kind of knew it would. So our agency offers clinical services to mental health for children from very young to ages 21 or so who live with their families. We have specialized programs to work with the Latino community. I have started over 8 years ago the Latina Girl Program, which was to deal with girls, young girls, and the risk of suicide. So I have a whole team that's able and working with that population. So we work with a very vulnerable population, vulnerable in terms of high risk for self-harm and suicide, and who also suffer emotional stressors related to the circumstances they live in. And some of our clients also have chemical imbalances. So that's the other part of the psychiatric problem. So right now, we're working with the clients that we currently have on the rolls, and we have open lines for any new person that needs us. So right now, I think our people, our community's kind of been hovering at home. We see that they're like, okay, it was like in the immediate, we have to stay home, we can't go out, and they're dealing with family members who are ill. I hear that from the kids when we go in virtually. We just got a referral from a school. We have 2 referrals. One, a grandparent died, another, a parent died. I knew that we were going to be getting that just about now. So we have the other kids who are having kind of psychiatric problems because they're isolating and maybe ruminating and feeling very stressed and fragile, psychiatrically fragile. We're trying to keep kids out of the hospital. We try to work with them on a wraparound to make sure we stabilize as much as possible. So I'm talking all the clinical mental health, meaning the clinician, the psychiatrist, working with their families. And in regular times, we can collaborate with the educators. There are partners in this, but as you could hear, our educators are not in the buildings either. They're also remote. So this has been a challenge. We're doing it. We want to let everyone know we are here. We are available. We have our phone lines will be answered. I give our regular agency number and website, but our regular number, the 516-626-1971 is the number we use for regular open hours. And then we have the Long Island Crisis Center handles our emergency after hours, but they screen the call and determine if they need us, there's a way for them to access us. So that's the 516-679-1111. And our phone line will tell people if they call during work hours, we have a intake worker who gets the call, screens them, and we'll get back to the family to get them a intake. But it's not a face-to-face in person, it's all virtual. So there's a lot of setting them up in the beginning. I really thought, oh my goodness, how are we going to do it? But our people are resilient. These kids are better at it. I'm also a clinician and I love the work. So I've been doing the virtual work myself, and they help you out. If you don't get your Zoom going the proper way, they say, Regina, do this, do that. Okay, we're good. So I even started a group. So we're getting our groups going as well. So we do the individual, the family, the groups, and we're taking new cases. We have been getting cases that discharges from the hospitals and psychiatric urgent care. Those, we screen them, we get them in right away. We try to get most people in within 48 hours of the phone call or faster if we need to, but they will talk to someone. Someone will even do a pre-screen to determine if there's an issue of safety and stability. So we are mental health, outpatient mental health for youth and their families, and we also have drug and alcohol for children, youth, and their families. Our populations are in Nassau County. The largest group of folks that we work with regularly are our Westbury community, Hicksville, Levittown, Port Washington, Glen Cove, I'm naming those for the Hispanic Latino community. The schools there know that we have bilingual staff, we have the specialized program, we will get them in and they will be serviced. So we service everyone on Long Island, but we do have these special programs for the Latino community.
Excellent. We have a bunch of questions in the chat here. So I'm going to start with the easiest one. Is there a charge for the service?
We use their insurance. So if they have insurance or Medicaid, and if they don't have Medicaid, you know, the families where we get the families, there's collateral charges that we're able to do through the Medicaid. Now that we're doing virtual care, they allowed us to do the billing through the virtual. And should they not have it, then we do a sliding scale. We'll work with them, especially now in this crisis. I mean, that is secondary.
Yeah.
But the main thing is for us, our catchment, our main population are the children and the families. So we're not seeing the adults on their own. That's
right. So here's another interesting question from one of our districts. They have 2 students who are not engaging. They have called Child Protective Services, the Nassau County Police Department. They have called and texted and tried to do everything to reach out for the family. What resources are available to support these students or students who are in a similar situation?
Okay, we also have high-end services. Then there's it's fairly new. If they have Medicaid, and this was not our rule, it's a rule that came down from the state, they get what we call other licensed professionals or a community.
Oh, did we lose you?
Well, those services usually, can you hear me? Oh.
Yeah, we got you back.
We good? Did it freeze? Okay.
Can you just repeat what you, I'm sorry, Regina, would you mind because you froze?
They are, okay, we have, it's the OLP, CPST, some of the agencies have it, other licensed professionals. When we are working, not virtually, when we're out in the field, those people go into the community and they make home visits. We are being very cautious right now at this phase of our care because we don't have protective gear. So we will make a determination. Staff is able to, when we have the services, to go to their home and do the assessment in the home, so engage that way. If they make the phone call and that phone call to us, we'll screen it and try and figure out, is there a way to engage that family.
Okay, and there was a follow-up question. How is that service different from CPS?
Oh, we're not child, because they're licensed clinical professionals. Yeah,
it doesn't involve like the system, so to speak. It's
no
more outreach.
No, it's no. That program is their clinical providers, so it's kind of doing the work outside the office.
Right.
So they would.
So the other question that's in here is, what languages do your therapists speak?
The program I'm speaking about right now is Spanish, English. We don't have another language. We don't have another professional speaks another language other than Spanish this time. We have Haitian Creole in our schools, and but they're not.
Oh, you're freezing up again.
I'm sorry, I don't know if that's there.
You have Haitian Creole in the schools, but they're not.
They have, so the outreach worker will do the translation for us. We don't have that right at this minute.
Okay. All right, do we have any more questions for Regina Barros?
There's one question. How do you get that service, the OLP service?
Call, just call. Tell them you want OLP. They'll understand, say it's an in-home need. And the same person, she'll take the information and there's a supervisor that gets those referrals.
Great.
Any other questions from the field? Great, Regina, I want to thank you for your time and for sharing that information with our colleagues. And if you have any other information that you want to send along to us in a flyer format or of any sort, we'll be more than happy to share that when we send it back out to the participants, because we'll list this video in our on our YouTube channel as well as on our web link. But if there's other resources that you would like to add, we'll be more than happy to forward that and attach that as well. So thank you.
Perfect, perfect. Thank you.
Okay. So Krista, next what we have, oops, I'm going too far ahead here. I have Karina Well, who works for the Hispanic Counseling Center. She's the team leader for the Newcomers After School program at the Hempstead High School, where they provide social and academic support to Hispanic students. And I also put here a little COVID phone number that people can reach should they need to contact Hispanic Counseling Center. Karina, welcome.
Hi, thank you everyone. Good afternoon. Well, I'm part from the Hispanic Counseling Center. What I do there, I'm the coordinator for the after school program for the newcomers. So we are right now helping everyone in the Hempstead High School from the 9th to the 12th grade and their families by providing social and academic support via Zoom, or it's very popular app that the students use. It's called the WhatsApp. You know, teenagers, they love to use these new applications, but we try to work with them via Zoom or FaceTime with them. But the critical problem that we have at this moment is the technologies, devices. I don't know if anyone can help me, guide me how to get these devices, because unfortunately in the Hempstead School District, there are not too many of these devices and families are having problem. Hispanic all the time, they're having calls from families that they need even a smartphone so the kids can do their work, because they marking it as an absent. You know, teachers calling them all the time, telling them that they're not participating. I understand teachers are under the pressure right now. They have to do attendance every single day. But unfortunately, the families at the Hempstead School District are not, you know, they don't have these devices. Not every family have these devices.
Well, I don't know if you heard Mr. Abenes speak earlier.
Yes.
They worked with the United Way and with Donors Choose to get devices out to families.
Yes, we're working with United Way too. They are helping us terrible. You know, it's awesome the way that they're helping our families, especially in the Hispanic community in Hempstead. Yesterday, I was also a volunteer with the Nassau County, you know, feeding all these families. It was over 1,000 families that Long Island Care was feeding yesterday. It was a great job. So we not only have the after school program, the Hispanic Counseling Center, we also provide other services as the control of substances, you know, mental health as well. We are open, we're still doing screenings, our psychiatric still, you know, doing telehealth using FaceTime, also by phone. So we are still open for the public.
Excellent. Does anybody have any questions?
Okay, I do also want to mention that there are certain plans, government plans called Lifeline Assistance, which gives low-income Americans access to free cell phones. or inexpensive cell phone plans. So I just want to put that out there if anybody's looking at that, because we always talk about how all the mobile carriers and cable companies are now providing mobile hotspots and free Wi-Fi. But that was a great question that you bring up, Karina. And so just to let everyone know, there is a program called Lifeline Assistance for cell phones, in regard, as well as other programs that I'm sure are out there. It's just a matter of researching all that.
Yeah, the high school has been very good. The Hempstead district has been very good, giving information to the students or the families about free internet for like 90 months. Now probably it's going to be extended. But you know, right now I think the critical issue is the devices for them, you know,
Right.
and the pressure from the teachers so the students can, you know, get into their online classes.
Right.
But thank you everyone for your suggestions and your ideas. Thanks.
Great. Does anyone have a question for Karina before we move on? Okay.
So if families or students needed your services, they would just call your main number?
Yes, if you want, I can write the phone number for the Hispanic Counseling Center.
I think we have it on our slide. Is it 516-538-2613?
Correct, yes. And like, again, we're providing mental health services, chemical dependent services, and our psychiatrists still getting phone calls via Zoom or using the regular just phone line.
Okay,
And we speak English and Spanish as well, yes.
great. And we have a comment that you're wonderful. They've worked with you many times.
Yeah, thank you. I'm trying, you know, I think at this time, everybody's trying to put just a little of their time to support the community. We are in this all together. We have to support each other.
Absolutely. We're all in this together, right?
Yes.
Well, thank you again for taking your time. And you're talking about we're all in it together. Speaking about together, you know, they say it takes a village. And in doing that, what I'd like to do is, I'm going to present Lisa Birch and her team. Lisa's a VP and Chief Operating Officer of Family and Children's Association, which is a 135-year-old not-for-profit organization whose mission is to protect and strengthen Long Island's most valuable and vulnerable children, families, seniors, and communities. She has her team who will be speaking about the various services that they are offering. So Lisa, I'm going to turn the floor over to you and to your team that's with you.
Thank you. Thank you very much. I'm so glad to be able to join you all this afternoon. Can I just get a time check? What time are we supposed to end? Because I don't want to run too late, and we have a lot of people from FCA on here. So I just want to understand what the timing is.
Absolutely. Right now we have until 3:15.
Okay, great. So I know there's probably going to be a lot of questions afterwards. So what I think I'll do is I'm just going to give you an overview of FCA and some of the services that we provide in the community, and particularly for families and children. And all of our services are bilingual. And I want to highlight a couple of them, and then I want to let Marc Fernandez, who is our Family First Clinical Director, talk about some work we're doing specifically with bilingual families in school districts. So as you heard, Family and Children's Association is a 135-year-old not-for-profit organization. We serve families across Long Island, primarily focused in Nassau County, but we do offer some services, including children's mental health services in Suffolk County as well. We have 5 divisions within FCA. We provide addiction treatment recovery services. We provide residential services, we provide children's mental health services, we provide senior services, and we provide prevention services. So as this is particularly focused on students and families with students, I just want to highlight, I think somebody else mentioned that We are a provider of what's called CFTSS services, which is Child and Family Treatment Services. They are services specifically for anybody who has Medicaid and the child has a social emotional diagnosis or is at risk of being diagnosed with a mental health issue. So those services are available and open to anybody, and we are able to provide them to bilingual families as well. And people can find all the information about our services on our website, fcali.org. We also post a lot of information about what we're doing, in particular now during this crisis, on social media, on our Facebook page as well. So in addition to our CFTSS services, which as somebody else mentioned, is OLP, which is other licensed professional, there's respite care, there's in-home services, and we do a whole range of family support services. And Jana Maynard is on our call, and she's our Family Center Program Coordinator. And I'm not going to let her talk right now, sorry, Jana, but just for the interest of time, if there are questions specific to our family support programs and the children's mental health, she's available to answer those afterwards. We also have Jasmine Lucas on, who is our prevention counselor in our chemical dependence prevention program. And that program works specifically with school districts. We work with the Hempstead School District as well as Roosevelt, I believe, and Uniondale, but somebody will correct me if I'm wrong. And we provide education around preventing substance use for parents and children, especially during this time. We've had our staff providing, making videos, creating videos, posting them on social media, and they're also available to do one-on-one counseling with parents as well as families. All of our services, as most organizations did, transitioned to telehealth services very early on during this crisis. So in addition to our children's mental health services, which are being provided via Zoom and Microsoft Teams and on the phone, we also have our drug treatment program, which operates out of Hicksville and Hempstead. Both of those are seeing some people on site still, but very few. Most of what we're doing is remote now, and we're doing telehealth and telecounseling services for people, including family members who have perhaps a child who is either addicted or at risk of becoming addicted and needs some assistance with that. So those services are available also if anybody calls. And we also operate two of the Long Island's recovery centers, one in Suffolk and one in Nassau. The Thrive Recovery Center is an opportunity for anybody who is in recovery to be able to connect with peers and to help them support their ongoing recovery. And we have groups every day happening for people in recovery via Thrive, as well as one-on-one recovery coaching, which is available. And then we also just recently, I think it's about 2 weeks ago, we launched a hotline specific for the immigrant and Spanish-speaking community related to COVID-19. And that line is available, and I think somebody's going to put the phone number and the information in the chat box, but we also can share the flyers for that, and it's staffed by bilingual folks who can answer any questions and help guide people within that community to resources that they might need. So I do want to take a minute though and turn it over to Marc Fernandez. Marc not only works on that hotline, but he's also the clinical director of our Family First program, which is a family counseling program. And Marc has a very unique aspect to his program where he's working currently in two school districts in Nassau County, Great Neck North and the North Shore School District, providing services specifically to the bilingual students and their families in those districts. So I want to allow Marc a few minutes to talk about what he's doing and what Family First can offer. So you're in, Marc.
Thanks, Lisa. Thanks for the introduction. I'm really happy to be here. I'm really happy to see so many different professionals from all different organizations and a bunch of colleagues as well. Like as Lisa was saying, Family First is a psychotherapy practice that is associated with Family and Children's Association. We provide individual counseling, relationship counseling, family counseling. A lot of what we're seeing right now is grief and anxiety work with individuals and families. And we're seeing a lot of relationship and marital concerns as well that we're able to work with over telehealth apps, Zoom and Microsoft Teams. And to what Lisa was talking about in terms of the school piece, you know, I'm really happy to also see so many school personnel in here. Myself and a colleague are both working with the Great Neck School District at Great Neck North and South High Schools, as well as North Shore School District, from all three elementary schools, the middle school and the high school. We are working specifically with the ELL Spanish-speaking population. We are doing, before all of this remote and distance learning, we were doing a lot of the in-person work in terms of that's trauma-informed. We are, you know, we're trained in TFCBT, trauma-focused cognitive behavioral therapy. And ever since the school closures, we have moved all of our services to telehealth, phone, and we've even taken more of a social worker type role in connecting families with basic needs and their resources, using the entire network of FCA and all of the other programs that FCA offers, which is an incredible resource for us to be able to very easily hand off and do some warm handoffs to other programs based on what the family is needs. They're all connected with this helpline as well. So the relationship between the school districts and FCA as an entire organization has grown immensely, and these services have made a big impact in the communities, not just from the students and the families in the school districts, but the community at large, because we all know that in the Hispanic community, everyone is out, or most people are out to help each other out, and so word gets out very quickly. I just wanted to mention a couple of points with the additional points with the school piece, that when we work with students, we're doing one-on-one counseling there with them to meet those individual mental health needs. We assess to see if there's any other trauma-related work that is that we can work with as well with them. And we also connect with the families, which I know that in schools there are many efforts that of course are made to reach out to parents to try and connect the students and engage more so with the academics and schoolwork, but there are certain limitations to that. And we're there to be able to extend that support and really connect with the families to do family counseling sessions, and to see what other needs are within the family. Being able to help a lot of the students right now, especially in the immigrant population, to really navigate this balance between some having to prioritize working over their academics has been one of the biggest challenges. And it's great for us to be able to have that direct contact with not only the students, but also the families, to see what we can do, how can we keep students engaged in the academic part of remote distance learning so that they don't miss out, especially with the way that, you know, there aren't regions being given right now, and so that they're not even further behind next school year, while understanding and respecting, of course, that they are out there with family members who are losing their jobs every single day, and they don't have the needs that that are as readily available as they may be to other people. And so we're really working hand in hand with each school's mental health team to help these families move ahead. So I know there's a lot of school personnel in here. If you are interested in inquiring about how we can maybe come to your school, please feel free to reach out to me. I believe the information will be in the chat. If not, I'll add it later. And if there are any referrals in terms of mental health services, individual counseling, relationship counseling, family therapy, feel free to reach out to us as well. Our group is made up of licensed marriage and family therapists as well as a licensed clinical social worker.
Great. We actually have a couple of questions that have come in that I'm going to ask real quick. The first is, what age group does FCA serve? Do you serve children as young as 5 years old?
Yes.
Yes.
Our
Okay.
CFTSS and in-home and care coordination services are available from 1, I think. Jana, correct me if I'm wrong, but I think it's very, very young up through teenage.
It's from birth to age 21.
Great. And another question we had was, how can a school or a family get a case manager to help with Spanish-speaking families?
So I think using the helpline has been very helpful for a lot of immigrant families to be able to connect with some level of case management based on what immediate needs they have.
Okay. All right. And then there's a long question. So are all these services available if a student is forced to live with a relative outside of Nassau County? So for example, if somebody in the household is sick and they go to live with somebody in New York City, does that case get passed to a New York City agency, or can they stay with you?
Lisa, do you want to take that, or I can speak?
Yeah,
to my
I'm not sure that I understand the question. So,
Alba, if you want to unmute
it, but
and ask the question, you can go ahead.
Hi, sorry. So we have a student who the parent is sick with COVID in the home. And had we used this service with him, for example, he now went to live with his grandmother in Queens. Had he been with you receiving these services, would someone be working with him even though he's living in Queens until the household has been cleared or the family is safe again? Or does it kind of, like, it becomes a long-term thing, you know, for whatever reason? I mean, heaven forbid anything, but would it get passed on to a New York City agency in terms of him receiving support, or would it stay with your agency if he began with you?
Yeah, I understand. I'm Jana, again, correct me if I'm wrong, but I believe that if a child and a family connects with FCA for any of our children's mental health services, we can serve them in Nassau or Suffolk County. If because of coronavirus, the child is relocated outside of Long Island, we're able to still connect with them virtually, so we can maintain that. Whether or not they stayed there long term and they were able to then continue with FCA once things get back to whatever normal looks like, I think would have to be on a case by case basis, because our staff travel to people's homes, and I don't know that we're able to go into Queens when there are other organizations in Queens that serve that community. So I think it would just have to be evaluated on a case by case basis.
Yes, correct, Lisa. I believe that it also depends on, the service that's being offered. I believe family peer support, which I will speak about in a few minutes, as well as OLP, like all the telepractice services that we're offering right now, they are offered, like we said, by either video chat or by phone. And so I think that if there's needs right now with the current situation, I think that we'd be able to continue to provide those services on a temporary basis for now. Correct.
And Jana, do you want to just share a little bit about how you're supporting parents, not just during this time, but in general?
Sure. I am, once again, Jana Maynard. I am the Family Center Nassau Family Peer Support Coordinator. I supervise family peer advocates who are credentialed parents of children who have a mental health diagnosis or have been at risk for a mental health diagnosis. These parents have kind of walked the walk and can talk the talk and have experienced personal situations in which it makes their relationships with the families that we work with very unique, in the fact that, you know, they've kind of been through the process themselves. And so prior to all this, you know, our family peer advocates, they connect with families in the community. We often take like walk-ins, and of course we get referrals from school districts and things of that nature. However, like I said, with our family peer advocates, they meet with clients on an individual basis, on a monthly basis prior to all this. Now with the COVID-19 pandemic, our family peer advocates have been reaching out to families more frequently on a weekly basis, on an individual basis. We continue to provide parent support groups that have been meeting weekly. We have parent support groups that meet during the day, also in the evening, because we do understand that there are parents that are working with, you know, having to do homeschooling with children and things like that. And so we've also actually implemented a self-care series. It's been a 4-week series for parents to engage in through Microsoft Teams in order for them to focus on their own self-care throughout all this. So we continue to just try to support our families as much as possible. We continue to take referrals. Like I said, there is the Family Center family support services are actually free of charge. We do offer family peer support services through Medicaid, that CFTS program, as well as caregiver support service as well. But again, you don't have to get bogged down with those terms. At the end of the day, it's pretty much just family support for parents in need. And the referral process is pretty simple. It's just like a 1-page intake form that can be sent to an email address specifically for children's mental health services, which I can provide in the chat box as well. But we're pretty much here, like I said, to just serve the families during this time, and just continue to just make sure that the support is out there, that families know the support is out there. All of our family peer advocates, they are English speaking. However, we do use a translation service for those individual parent support meetings, if needed, that we've been using prior to all this. So we do have a great working relationship with them. So if you guys have any questions, feel free to reach out to me. I could leave my contact information in the chat box as well. And
Great.
Our family support.
Thank you so very much. And again, I want to remind everyone that I have your web address on our resource page, so that once this is done and they receive it, they can link on to all the phone numbers and all the services that you offer. And again, I invite you to send us any information that you have that, in addition to that, what's on your website, that you would like for us to send out to our colleagues as well. So thank you very much. And Lisa, thank you to your whole team. Thank you for being here.
Thank you.
Time. Great, great.
Thank you.
Okay,
Thanks.
and great. Is there any other questions that we want to ask? All right, well, you could always email us or email them directly. Marc has also provided you with his email address as well. Okay, so next I have Isabel Costra and Consuelo da Costa from Catholic Charities, and that team was presented for us for the Suffolk County districts and came back for Nassau County. Isabel is the supervisor of New York Services to At-Risk Youth, and she has worked as a disaster case manager with Catholic Charities from beginning to the end of the program. And Consuelo is a bilingual case manager with 10 years experience. And ladies, I'm gonna leave the floor to you.
Okay, thank you. If we don't have much time, I think, but I will try to explain about the services. And first of all, NYSARI means New York Services to At-Risk Youth. This is a pilot program. It's a 3-year contract, so we are during the 2nd year. And this is for Long Island. We work with teenagers 13 to 18 in Nassau and Suffolk counties. That's why I had a presentation on Wednesday for Suffolk, and now it's Nassau. And right now we are working in Amityville. The main office is in Amityville, but we also work in Nassau County with different Catholic churches or parishes. The services that we provide are mainly for the teenagers to prevent that they go into a risky situation like drugs, alcohol, addictions, drop off of schools, teenagers' pregnancy. So the services that we provide mainly are health related. So we help them. I want to mention that this is mainly, the program is mainly for just arrived teenagers and accompanied minors, mainly from the Central America countries of El Salvador, Guatemala, and Honduras. I said mainly because we welcome also children from other countries, and the age has to be till 17 to join the program, but they can stay till they turn 19. The activities that we provide are like the services that we provide are health, with a health insurance mainly, legal. We help them to get an attorney or a counselor, not only in Catholic Charities Immigration, but wherever they can apply. Then we provide also support groups. We have referral program to counseling, individual, family counseling in Nassau and Suffolk again. And we have recreational, educational activities like different classes. Mainly it has been computer classes because we got 10 computers in our office. We also teach English because most of the kids that arrive here have no knowledge of the language. We had painting classes. We had, during the summer, we went to the different parks, museums. We practice sports in different schools. And also we had workshops like spiritual workshops. Right now we're going to have an immigration workshops at 3:30. And right now we are using the Zoom, the same as now we are using this. We're providing classes also through Zoom, so the kids are already familiar with this, usually in the afternoon, because in the mornings they have their classes. And we have also the online support groups. Right now, we have different workshops, like I said, resume writing and job skills for teenagers. And I don't know, Consuelo, if you want to add something. Consuelo, are you there? Well, Consuelo is the case manager.
Can you hear me now?
Yes.
Can you hear me now? Oh, okay. I'm sorry. I think this thing got muted. So regularly we do a lot of activities with the minors. The program is really targeted to minors that have just arrived to the country, as Isabel was explaining. This program has been a very supportive program for them, as they don't really know anything yet about the culture. They don't know English. Sometimes they have been separated from their family. So we do give them referrals. Some of us are counselors and social workers. So we work directly with the minors and their families, supporting them through the whole process of coming here and adapting to their new country. We usually do activities that we take them to museums and trips and things like that. Right now that everything has changed, we're very in close contact with the families through this ordeal, which has been very difficult. We have been also delivering food for them from the food banks. We've been in constant contact with them, just trying to support them. With the minors, we're doing Zoom classes pretty much almost every day after school from 3 to 4. We have computers, English, extra help, math. So we've been very busy lately. Our headquarters are in Amityville, but we work with all of Long Island. I specialize working with Hempstead, Uniondale, Freeport. I work with Huntington Station, and other case managers work with the rest of Suffolk County. So if you want any information, if you have families that are going through this process, you can let us know, and we'll be looking forward to hear from you and to support them. Thank you.
I do want to share, Consuelo, that in our resource guide, of course, we have Catholic Charities listed, and we have the various offices and phone numbers available throughout Long Island. So that's also available. I just wanted the participants to know that.
Oh, yes, that's very good. Yeah, they can reach us. We're in Amityville. We're part of Immigration, and we work with the young people and their families.
And also, sorry, I saw a question asking how long is a new immigrant. We consider up to 2 years. We prefer to start working with teenagers that arrived to the country recently. So we help them through the health insurance, registering them in school, linking them with attorneys. So if they recently arrived, they are in need of all this to acclimate to the situation in their country. But also, if they arrived here a few months ago, we can still have accept the clients, let's say up to 2 years. They are active clients. If they have been here more than 2 years, they will be more like passive clients. They don't need us as much, but they can participate in our activities.
Great, great.
And our number, do you want me to give the office number?
Yes, please.
Yeah. We work Monday through Friday, 9 to 5 in Amityville, and we are answering the phones at 631, is the area code, 631-608-8282.
So that was Monday through Friday from 9 to 5, is that correct?
That's correct. And the activities sometimes are also after 5, sometimes on Saturdays. But right now, you know, we still have somebody answering the phones in person. And also the case managers and I, we are working from home. And once a week, we go to the office also. So we have our sales, but you can call there to refer as clients. We would appreciate very much. Right now we have 120 clients, and most of them are in Suffolk. Let's say 60% in Suffolk, 40% in Nassau. We have a little bit more boys than girls, but we are open to the community. So we will be waiting for your referrals, and I will be sending a flyer. The flyer is a draft, it's not approved by New York State. I want to mention that this is a program from New York State, and it's a pilot program. So they have to approve this, but maybe I can send you as a draft a flyer, and you will see the information there, okay?
Great. Thank you so much for sharing that information. And as well to the participants, I let them know that we do have your web address, not only in our resource guide, but also at the end of this presentation. So thank you for coming back and sharing that valuable information. And Consuelo, thank you as well.
Thank you so much for having us.
It's a pleasure. So before we end, there was another organization that wasn't able to make it on the phone with us, and that's the Long Island Crisis Center. And so Laura Campbell's the Director of Education, but I did want to provide that information to our participants with the phone number there, 516-679-1111 to speak with a counselor. And they're available 24/7 crisis intervention agency. They answer mobile crisis unit for Nassau County, the National Suicide Prevention Lifeline. They offer suicide outreach to those and even to people who are worried about others. A very strong community education program that reached over 25,000 Long Island students last year. And even schools can call them to do, once we come back into the building, they do presentations and workshops on suicide prevention and depression, understanding self-injury, cyberbullying, managing emotions, let's talk mental health. The list goes on and on and on. So I did want to I did want to provide that to everyone. And as I mentioned, here are the resources that are available to families, some of them that were talked about today in our workshop. And again, that's available for you. In addition, you also have all of the community-based organizations that presented. In addition, you have some of the Suffolk County organizations as well. I've also provided you a link with our L resource guide, which also lists the email addresses, web links, phone numbers, locations of the different offices of the ones that presented today, in addition to others throughout Nassau and Suffolk County. It's a valuable resource guide, and the community-based organizations begin on page 34. So hopefully you were able to get a lot of information. We do want to just reiterate, ask you to go onto your My Learning Plan to confirm your attendance as well. When you sign on to My Learning Plan, you will see there is a little clipboard with a check mark. That is the evaluation form. We really value your feedback on how we can support you moving forward throughout COVID-19 and in the future, what we can do to support the work that you're doing. This will also help us to confirm your attendance. So we ask you to do that. You just sign on to My Learning Plan. You find the program that you registered for, and you look for that checkmark clipboard, and that will be an anonymous evaluation. We ask you to please fill that out. Also, when you go into My Learning Plan, you can see it says Session Workshop Evaluation. It'll take less than a minute to fill that out. So we appreciate your feedback. Of course, we're always available through the Long Island Arburn email address. And we thank you for your time. Everyone have a great weekend. Stay healthy and safe.
Bye, thank you.
Thanks, everyone.
Bye, thank you.
Bye, thank you.